Good morning, everybody. This is Dr. Stephanie Vanterpool, Director of Comprehensive Pain here at University of Tennessee Medical Center. And it is my pleasure to talk to you today about an upcoming webinar we're very excited to share with you. It's going to be a free webinar for anybody who's interested in registering, and it's going to be talking about targeted pain treatment, but this time with a bit of a twist. We're going to be speaking about interventions. Those are things like procedures or injections that we use to help patients improve their quality of life by treating the source of their pain. It targets the anatomic source of pain. What that means is the nerves or muscles or joints in your body that are making you hurt and stopping you from doing what you want to do. And what we're wanting to do is give you information to help you make an informed decision about whether or not targeted pain treatment and targeted interventions might be good for you. I want to share a couple of things with you about what you can expect at this webinar. We're very excited to have 3 patients who have been willing to share their stories about their injections, and that is going to give you some insight into what it's like from their perspective in terms of what it's like to have the pain, what it's like to go through the procedures, and then what it's like to feel the relief after these procedures. We're also going to have a Q&A session with both myself and Dr. Jonathan McBride, who is my partner at the University Center for Pain Management. We're going to be answering audience questions about procedures, how you can decide what procedures we're going to do, and then how we can figure out what procedure is right for you. You'll also have an opportunity to see some examples of kind of where we're going to be doing things and how these procedures can potentially help you with your pain and quality of life. But most importantly, we want you to feel comfortable and ask questions that might be on your mind so that you can figure out if this type of treatment might help you or a loved one live life not limited by pain. The title of the webinar, which again is going to be on October 22nd at 12 p.m. Eastern, is going to be Injections and Procedures, What, When, and Why. And as I mentioned, talking about types of procedures, talking about how these procedures work to improve your function, what you can expect before, during, and after procedures. And again, we'll have those patient videos and patient webinars, those patient examples. And then how we go about choosing what procedure to use to target your pain. Specific, strategic, and safe. That's what we use. Now, I brought a prop. Are you ready? Here we go. This is a spine. Can you see it real well? I wanted to show it to you because so many times when people talk about injections, they think, oh, those shots don't work. And the thing about it is we've got to be specific. We've got to put the injection in the right place on the spine. Do you see all of the different components here? You've got nerves coming out the side. You've got bones in the back. You've got joints on the bottom, holes on the side. Every one of these anatomic locations can represent a potential source of pain. So when we do these injections, it is so important for us to be exactly where the source of pain is coming from. Just because your neighbor had an epidural and it may not have helped, doesn't mean that, number one, an epidural is even what you need. That's a type of procedure. You'll learn more about that on the webinar. And because they had it in one location and it didn't help, doesn't mean that it might have been in the right location for their source of pain. Because the body is such a wonderfully complex organ. There are so many potential causes of pain, and we want to make sure with targeted pain treatment that we've accurately identified that cause and treated it appropriately. So I want to encourage you to join us. October 22nd, it's a Friday at noon. It's a virtual webinar. Registration is completely free. If you want to know how to register, check the comments in the Facebook Live. You'll be able to sign up for free and share it with your friends. Get as many of them on as possible. Any loved ones who help you make decisions. And the other thing that's a really cool feature of this webinar is that you'll actually be able to speak with vendors who provide some of the equipment and procedures that we use for these procedures. So there are going to be vendors who have exhibited with us that you'll be able to talk to and see some of the equipment that they provide and some of the types of devices that they provide that we can use to help you improve your function. So you don't want to miss out on that opportunity either. I encourage you to sign up. Go to the comments in the Facebook Live chat. There's going to be a Facebook post where you can actually share that with your friends. Follow us, the UT Medical Center, on Facebook, LinkedIn, or Twitter for more information on that. And you can also follow me, Dr. Stephanie Vanterpool, at SVanterpoolMD on Twitter and SVanterpoolMD on LinkedIn. And we'll be happy to get you as much information as you need. and I'm happy to take any questions you might have. And I'll be on for the next few more minutes, so make sure you register October 22nd, 12 p.m. Register as soon as possible.
We do have one question, Dr. Vanterpool. So
Yes.
somebody that's not able to make the webinar but is experiencing some pain, how could they interact with you or schedule an appointment?
Absolutely. So in order to interact with me or schedule an appointment, I encourage you to go to our website, ucpmk.com. That has information on how you can register to be or contact us to be a new patient. We do accept patients through physician referral, but our referral coordinator, her name is Gretchen. She is awesome. She'll walk you through that process. The other thing I want to encourage you to do is if you can't make the webinar, go ahead and sign up and register anyways, because the webinar will be available for 30 days for free for those who register for it in advance. So make sure you register even if you're not able to watch it live.
Great. I think that's it.
Okay, awesome. Thank you so much for your time. I look forward to seeing you on October 22nd. Make sure you join us, and don't forget, go ahead and get out there, be active, and be healthy. Take care.